My portion of the Howard Taylor International Symposium is to discuss the status of maternal mortality in the United States. It's an important topic for the attendees to understand that their participation in maternal mortality activities is crucial to improving the health care for our patients. Even in 2010, the Joint Commission put a spotlight on maternal mortality by identifying it as a sentinel event. In the early 20th century, maternal mortality in the United States was somewhere in the range of 1,000 per 100,000 live births. And that declined dramatically during the century to reach a nadir of about 8 per 100,000 live births in the mid-1980s. It remained stable for a number of years, but we've noticed a disturbing rising trend over the past few years. In fact, in 2003, the reported number was 16 per 100,000 live births. In the older times, the causes of maternal death in the United States were hemorrhage, hypertension, and thromboembolism deaths. But we've noticed that that's changed. Efforts to improve patient safety have lessened those causes, and now issues such as cardiomyopathy, other cardiovascular diseases, and other medical conditions represent the majority of maternal deaths that we count. What's important as far as you're concerned as a practitioner? It's important that you identify those underlying medical conditions that you can optimize to improve your patient's health. It's important for patients to recognize that their medical condition can lead to a healthier pregnancy. Reduction in obesity in the United States is an important issue, as it contributes to diabetes and hypertension. It's important that we recognize those patients at risk for hypertension and thromboembolism and take appropriate precautions at the time of their delivery. Last but not least, we need to recognize that cesarean section is a rising trend, and that rising trend leads to increased risk for placental abnormalities and other hemorrhagic conditions. Last but not least, we have to always remember that every maternal death is a woman who we need to put a face on, to remember it's her condition, it's her life. It leaves not only an emptiness in society, a hole in the family, but it leaves children motherless, and that's the most important condition that we can deal with.